Hi, my name is Jennifer Denton.
I'm Amanda Dickinson.
And I'm Shantae Davis.
And today we're going to talk to you about fluids and continence.
Yeah. Good.
The importance of fluids. Well, the water is an essential part of life and is a key survival to the prevention of hydration. It is found to be that 55% of water is actually in the elderly and 75% body weight is in pediatrics or in the younger population. The elderly are found to be less thirsty, and we'll go into reasons why that is a little bit later on in the PowerPoint. Hydration is critical to the body's process of temperature control, and that's something else we'll touch on. One way to find out or see if a person is dehydrated is a little acronym they created for the actual word dehydration. So D is for your diuretics, or drugs that causes you to lose that fluid. E is for the end of life. H is for high fevers, yellow urine or dark urine. You know, when someone is using a Foley, or you can see it's concentrated, that could be a sign. D for dizziness. R for reduced oral intake. When not taking in, obviously they're going to be have that dehydration effect. A for axilla dry, your mouth dry. You have T, tachycardia, your heart rate goes up. I, incontinence, when you're not able to hold your fluids. O, oral problems, sippers, it means they're not taking in a lot of fluid. And N, neurological disorders or confusion or sunken eye effect. Continence. Urinary continence is an involuntary loss of urine sufficient to be a problem. So it's a costly problem. It also affects women more than men in the elderly. And it often goes undiagnosed or untreated because a lot of people think of it as a part of the aging process, which is not true. Affects millions of adults worldwide. There's different types. There's urge, there's stress, there's functional, there's mixed. Urge is when, as soon as you feel the urge, you've already lost control and you're not able to hold it. Stress is when you're doing some kind of physical activity that has abdominal pressure, like lifting or sneezing, and then you lose control. Functional is when everything actually, you can hold it, but there could be physical barriers or cognitive barriers, like maybe the line's too long, or maybe you just thought about it too late. There is a couple mixed ones. There is also the mixed, where it has a little bit of everything in there. And then there is one where it's like mixed or overflow, is when you're not able to hold it, but you become distended because you're not releasing enough. But each one of those we'll go into a little further as well and explain. So I'm going to let Shantae talk to you about health concerns and health trends.
Good morning.
Dehydration is when you lose more fluid than your body is taking in. It is very, very important to keep our elderly hydrated because altered mental status can happen when they get dehydrated from UTIs. Vital organs such as the kidney, brain, and the heart cannot function without the proper amount of fluid in your body. Older adults are at higher risk of dehydration than younger adults are. As we age, our bodies are able to conserve water less, and we do not respond to temperature changes the way younger adults do. Also, older adults do not realize they become thirsty as easily or quickly. Because of this, older adults are often prone to dehydration and need to be prompted to drink more. Recovering from dehydration requires replacing the fluids that were lost and also curing whatever happened, such as a UTI, to help alter mental status. It is important to not stop eating or drinking and not to drink or eat beverages that promote further dehydration and that may increase nausea, which makes you also more dehydrated. It is especially important for older adults to stay hydrated because dehydration can also lead to dizziness or falls. Some of the factors that contribute to dehydration are more common in the elderly, including the use of prescription drugs and a decreased sense of thirst. When the pressure in the bladder exceeds the sphincter pressure that can be held, incontinence can happen. There are several different types of incontinence. Even though it can happen at any age, it's more common in older adults due to the weakening of the muscles. In nursing home populations, at least 50% of residents have urinary incontinence. There are 4 different types of incontinence that are popular: stress incontinence, overflow incontinence, functional incontinence, and mixed incontinence. Urge incontinence is the most popular one in the elderly. It is having the urge to go and not being able to relieve your bladder. The loss of urine usually happens, which is why they make the pins. Stress incontinence is caused by muscle atrophy. So most of us nurses will have stress incontinence because we hold our bladder too long. Overflow incontinence is rare, but your bladder never completely empties, so you always feel like you have to go and you kind of tinkle. Dribble. Functional incontinence is caused by disabilities such as MS, and mixed incontinence is where several of them are all together. There are several different ways to treat urinary incontinence, such as medications, oxybutynin, pelvic floor muscle exercises, which are your Kegels, bladder training, which is when you do scheduled bathroom trips, when you go every 2 hours to toilet and try to train the bladder, retrain the bladder and the bladder muscles to control urination. Amanda?
Some teaching and learning strategies for fluid replacements. Fluid requirements for older adults who are not under fluid restrictions is 1,500 milliliters per day. Risk factors for dehydration, as we've gone over a little bit before, is delirium, kidney infections, kidney stones, constipation, seizures, hyperthermia. And the mortality rate from dehydration can be as high as 50% in the elderly. We have to assess the patient to determine their learning strategies that we're going to use, if they have any mental deficits due to a stroke. And once that's figured out, we can go forward from that. We have to instruct the patients to check their urine, to look for signs of dehydration, such as the change of color from a clear yellow to a dark red, dark yellow color. They calculate a daily fluid goal for patients that they can use when they get home. Compare the patient's current intake with what they need. Offer a variety of fluids that the patient enjoys. Have the patient plan for additional drinks during the day, such as when they're taking their medication, instead of having maybe just a few sips of water, have them go ahead and drink 1 glass of water with their medications. And they can increase their fruits and vegetables that are high in water content. Citrus is a good one, but again, you have to make sure it's not going to interfere with any types of medications they were on at the time. Bladder changes, and you have to explain the bladder changes that happens in the aging population, that they have a decreased capacity to hold urine. The increased irritability, contractions during filling, and incomplete emptying is another one. Involuntary bladder contractions can lead to increased frequent nocturia urgency, which is going at night. A lot of older populations complain they get up several times a night to go to the bathroom, and a lot of times they end up falling and hurting themselves because their area is not clear shot to the bathroom. And they also have a high rate of UTIs due to this. Older patients may not bring up their concerns, so it's important that we ask questions about it. We also have to assess the patient for understanding of what their body's going through as they age, and let them know that it's a normal process, and that may help them in the future. Explain the exercises again that we touched on earlier that they can do to strengthen the pelvic muscles. Show them a variety of products to use, such as incontinence pads. Depends is the main one. Have them do a schedule at home every day to make sure they go every 2 to 4 hours during the day. So it helps develop a program for them to work on. And limit their fluids after they eat dinner at night to a half a cup to 1 cup of fluid, so they're not up all night going to the restroom. if it gets to a point where they're having severe problems and they end up in the hospital, then for fluids, of course, the IV fluids they're having to give, they can do it through the nasal tube or PEG tube if the patient gets that far in distress. And for incontinence, a lot of times they end up in the hospital with a Foley catheter, or for men, a condom catheter is a lot better because it decreases the UTIs in patients. So here's our references, so thank you very much.